Alright, beautiful. So I'll just start off explaining what we use the airvo for. Alright, so this machine is a great machine. It's made to deliver high flows of air and oxygen to patients. Alright, so you know with your non-rebreather masks, you kind of deliver about 15 litres of oxygen via that. With someone who is in respiratory distress, so high respiratory rate, hard work of breathing, often that 15 litres isn't enough to meet what we call the inspiratory flow demand of that patient. So to explain it a bit further, someone who's breathing like this may have a peak inspiratory flow demand of about 30 litres a minute. Alright? If you put them on a non-rebreather mask, they're only getting 15 litres a minute through that non-rebreather. They're having to pull the extra 15 litres from the atmosphere around them, from the air. So their work of breathing will still be elevated. If we pop that patient onto an airvo and we tell the airvo to deliver 30 litres of flow, that flow that's being delivered by this machine will effectively meet their inspiratory flow demand and theoretically should decrease their work of breathing and their oxygenation. Does that make sense? Is there any questions about that concept? Because that's quite an important concept to understand with regard to identifying patients to put on the airvo. All good, tickety-boo? Excellent, all right. So, we'll just discuss the circuit first. Now, the circuit comes, so the actual circuit and the humidifier come together. Your prongs come separately, as does your oxygen tubing. Do you all know where each of these bits of equipment are kept? Is there anyone that doesn't know where the equipment is kept?
Here?
Yeah.
We all know.
You all know?
Can someone tell me if I was alone in the department and I needed to find them, where would I go? To the back of this room? There's a box? Okay, thanks.
And all of it is together, so you can get this, and this. Beautiful.
Okay, great.
You know, sometimes if you're in a rush and you have got someone that's coming in that's crashing and you need to find the equipment quickly, you don't want to be looking
in every cupboard.
Yeah. All right.
Great.
Okie doke. So your humidifier also comes with this piece of plastic here. All right. That needs to go on top, and then I've got a willing volunteer. Please. Oh yeah. Cool. You grab that. And what you want to do is slide the humidifier onto this base plate. It can be a little bit tricky. You actually need to slide it on and push that down at the same time. And this here will need to go into these two holes. You should hear, when it's in place, you should hear a click from this base plate. So be firm. That's it.
Hey.
And then obviously this will hook into your distilled water. Yeah, beautiful.
Do we have some water?
Is this an education?
It's just been ready.
Just been, yeah.
Goes in there. Looks like that.
Great.
How does it stay on?
Oh. Got a bit of tape or something.
Yeah. Oh, yeah.
Ah, yeah, so.
Alright, so the next thing we're going to pop on is your tubing. Bit of a trick to this. If you put this, you should be able to pull this sleeve up. Sometimes, not all the time. So,
Yeah.
see you've got 2 pins here.
Yeah.
So those 2 pins need to match up with these 2 pins at the back.
All right.
Another willing volunteer. Thank you. Can you pull the outer covering up a bit? Just that. Oh no.
Yeah.
And with sometimes you'll hear a click. If that's a scene now you can't pull that off, so that's really quite secure. So that's good to go. And then the next thing you want to attach your interface, so your prongs, and they should also click into place. All good so far? Any questions? Okay, so just hang those up there. And then your oxygen tubing. So your oxygen tubing will attach to here, and then obviously onto your flow meter. Yeah. I'm just going to turn this airvo around. In the back here is a filter, all right? And also in the back here, this is where the air is entrained into the airvo, so that it mixes with the oxygen that we're delivering from the oxygen cylinder, all right? So that air and oxygen creates that flow that we're putting through the airvo into the patient. So a mixture of oxygen and air. So now we can turn the airvo on because it's ready to use. Can we have another willing volunteer? Brave enough to turn it on.
Yeah.
Oh, once we plug it in. Let's plug it in. Thank you.
Come through
So to turn it on, you just, if you hold this button down to the back, I think it's about 3 seconds. And just watch the screen. What should come up is a traffic light picture, and you should get a green on the traffic light, which means that the circuit has been disinfected and cleaned. Sorry, the machine has been disinfected and cleaned. So last disinfection 428 days ago. Have you not? You would have used it in the last.
Why didn't eat this?
Hey? That's okay, a year ago. Alright.
Our daughter is telling the line.
Yeah.
So it should be a green traffic light, alright? But what we'll do after we've set this up, I'll show you how to clean it and disinfect it so that it's good to go for the next patient. Okay. So whilst it's just calibrating at the moment, you just circle here. Once it's ready, that circle will have a tick in it. Okay. And what we're seeing here is we've got humidification, the flow that we're going to deliver, and the FiO2 that we're going to deliver. All right. So we'll just wait for a moment until all of those settle. And we'll demonstrate how to change each of those settings. Any questions? Or do you do anything
When we
differently?
run out of distilled water, like the vacuum, is it okay? We get the warm water?
Absolutely. If that's what you normally do, continue doing that. That's grand. Alright, so see that tick there? So now we're good to set up the airvo, right? Now, who wants to volunteer for this part?
Yeah.
You're doing well. So, with the humidification, so normal anatomical humidification is 37 degrees, alright? So we're actually going to set this to 37.
Just increase the power.
So, well, there's a bit of a trick to this.
Yeah.
So, if you press your play button first,
This one.
alright, so see how it's at 41 at the moment, see how it's locked? So we need to unlock the airvo, and you do that by pressing the 2-hour buttons for about 3 seconds,
This.
and that should unlock. Beautiful. So now you can increase your humidification setting to 37.
Right.
Now,
One another.
Warna
rasa.
so happy?
Yeah.
The
Okay.
next thing you want to change is your flow. Alright, so that's how that's relocked itself. To get to the flow, what do you think you're going to do? Which button again? Okay. Yeah. So just press the play button again. And you're gonna set up your flow.
Dulu.
So we start off with a 30-litre flow and start low, and then we'll increase and I'll show you what happens to the oxygen levels. Okay, so we have now told the machine that we're going to deliver a 30-litre flow, and that's going to be a mixture of the oxygen we're about to set and the air from the atmosphere. Just one thing to mention, just going back a step, with the humidification, some patients may complain that 37 degrees is too hot and it's too hot within it. You can actually reduce it to 34 degrees if that's the case, alright? So now you know how to do that, it's easy to do. Alright, so what we want to do now is set the FiO2. So the patient that was working like this, and probably needs about a 30-litre flow. Let's say they're going to require, they've got SATs of 84%, alright? So let's start on an FiO2 of 40% and see what happens. Now, this is the trick. You don't set the FiO2 on the airvo, you set the FiO2 using your flow meter. Yeah. Now,
Trick.
just a little handy hint. When you do set your flow meter, this can be quite temperamental, and it can take a while for the airvo to register the amount of oxygen that's going through. So dial up nice and slowly, reasonably slowly, until you get to about 40%. And then just watch your FiO2 increase on your airvo. And it doesn't have to be bang on 40%. If you get 38 or 42, that's absolutely fine. 28. Slow it down a little bit.
Down.
Oh, you got it in the watch here.
Yeah.
Yeah.
Hey, down.
So, in order to get that 42, FiO2 42, what flow are you on roughly? What flow is your flow meter on?
36.
So that's how, what number is it on this one?
8, 6, 7.
7? Okay, let's go with 7. So in order for this airvo to deliver a flow of 30 litres at 40%, we need a flow of 7 litres per minute. Alright, so just remember that, because what we're going to demonstrate next is how flow and oxygen are related on the airvo. Okay, and I'm sure you will have all come across what we're going to demonstrate next in real life. Okay, so you're now ready to place your prongs on your patient, alright? And you do that, and you obviously stay with your patient to make sure that it's having the desired effect. So you'll be watching their work of breathing, you'll be counting their respiratory rate for a full minute, rather than 15 seconds and multiplying by 4, like we're all guilty of. And seeing if this helps with their work of breathing also, okay? Now, in this situation, we are going to presume that the work of breathing is still quite elevated, and the oxygen sats have come up to 93%, all right? So if we've got this patient is still working quite hard, but has sats that you're happy with, what do you think we can do in order to make the patient more comfortable and reduce that work of breathing? There's probably 2 things. Positioning, yes, excellent. That is absolutely right, and that's a reasonably simple
One and a
thing to do, isn't it?
What a novel.
Gold star. So sit them up and make sure that they're ventilating those lungs. What's the second thing we can do with regard to the airvo?
Increase the oxygen.
If you've got sat at 93%, are you reasonably happy with the FiO2 levels? Or would you, what would you do in normal practice? Would you increase? 93?
You can increase.
Okay, yeah, if that's what you would normally do in practice, then we can increase. That's fine. What else can we do?
What about if we slow this
What do you mean slow?
to decrease the the temperature was at 37,
Yeah,
and then the patient is complaining it's too hot. We've already decreased it to 34.
absolutely.
Now can we decrease it down more or still?
So your patient isn't complaining of it being uncomfortable, but they're working quite hard still with this flow of 30 litres and 40%.
So they have air hunger. They're hungry for more air. So what do we need to give them?
Increase
Increase what?
the flow.
Yeah.
Yes. Because currently we're not meeting the flow demand that they are requiring. Alright?
And remember, it's not just about oxygen. There's other things going on in their bodies that might be driving that respiratory rate, like carbon dioxide and acidosis. So even though the oxygen might look good, they might still have this air hunger.
Yeah.
So they need more ventilation, more flow.
So from this 30, you can increase it up to what level?
Yeah, what do you think you might want to increase?
40.
Okay, well let's increase it up to 40 and see what effect that has on the patient. Does someone else want to come and have a go at increasing the flow?
Playing with the buttons.
Yeah.
It's good to play with the buttons.
Well, do it now because it gets
Yeah.
better to do it now.
It's not
than
stress-
next
well, I
week.
know.
Right.
We were watching you, but that was quite stressful.
Rani's a queen, so it doesn't matter.
Yeah.
Wait.
Before you start, what I want you to do is, so just remember 30 litres, 37. What we're going to do when we increase the flow, keep an eye on what happens to the FiO2 levels. Alright? What do you think might happen?
And then you need to unlock.
No.
So about 3 seconds.
3 seconds.
Ew.
Good.
And then increase.
Five.
Ew.
Yeah.
What a novel.
Acha.
And then if you want to relock it, you just press your play button.
Five.
Now, one more thing I would like you to do is press your play button again until you get those three, until you get your humidification and your flow and your oxygen on the screen.
Back to home.
Five.
And again.
Alright.
What's happened to your FiO2 levels?
Decrease.
It's decreased a reasonable amount, isn't it? From 14% to about 33%. Why has that happened? Say again.
Because of that, I mean, we are adjusting it from the oxygen cylinder, so maybe it's at 7, so we need to increase that one up to actually 40.
We do need to increase to get back to 40, yes. But the reason why this has dropped is because the airvo is having to entrain more air. So there's more air now mixing with the oxygen. So we've kind of diluted the oxygen molecules in the circuit. Right? So it's just from a practice point of view, whenever you change your flows, whether that's up or down, always check your FiO2 because I can guarantee that will need adjusting. Alright? So we wanted to adjust the FiO2 to, did we say 50? 40. Alright, so do you want to increase your FiO2 to 40%? How are you going to do that? Yeah, beautiful.
Dire.
Go. Pakaro, koko. Semua. Semua.
Is it Ramalua?
Bakalebo. Lalu.
Nearly there.
और पकड़ो ऊपर
Doing well. Tiny bit more.
pull the ball
Yeah. Press that, please. It goes into sleep mode.
aste is what
Slowly.
oh
So that you're around 40% there now. What flow is on your flow meter now?
11.
11, there you go, alright. So we've had to increase the amount of oxygen delivered because we're retaining more air. Does that make sense?
Yes.
Yeah? Any questions about that so far?
this one you don't have to let it be empty like this this is
Really good question. So, in real life, are these the bottles you use in real life? No. The big one. So
and then we cut the normal line, we put the warm water.
that's grand. So this humidifier is really clever. It'll because of gravity, it'll pre-fill to this thick line here. Alright. So obviously the more water you put in your bottle up here, the longer the longer humidification will last. One of the alarms we see quite often on the ward is, I think it says something like water chamber. Comes up yellow here, and I can guarantee 9 times out of 10 it's because you run out of water, so you just need to replace the water. That's an easy fix. Does that answer your question? Great. All right. What I'm just going to demonstrate now is another alarm that we see a reasonable amount on the wards as well. And that is to do with when you decrease the flow in the airvo. When you decrease the flow in the airvo, what do you think will happen to the FiO2 levels?
If you go down to
If you decrease flow, so, hey? Yes. If you decrease your flow, so you're pulling less air into the airvo, your FiO2 levels will go up because the oxygen is less diluted, to the point where you can deliver 100% oxygen, alright, which in effect is actually quite dangerous, because sometimes our patients don't need 100% oxygen, and as we're sort of now starting to learn, oxygen can also be, we're always taught that oxygen was good, but now there's a lot of evidence to suggest that oxygen may also be a little bit bad for us. That's not to say that we shouldn't give oxygen if someone has got low sat, we absolutely should, but we need to be cognizant of how much oxygen and sort of look at weaning. If someone's got sats of 100% on 50%, 50% FiO2, do they need that FiO2 50%? Probably not. So you could look at weaning down that FiO2.
And also then you save your oxygen for the next patient.
Good point. All right, so same patient, a couple of days later, work of breathing has decreased, respiratory rate has decreased, and SATs are reasonably okay, all right? So we've been asked just to drop the flow to 20, let's say 20 litres, all right? So do you want to come and drop your flow to 20 litres and see what happens then to your FiO2?
Oh shit.
So,
It'll automatically lock itself.
Yeah, if
but
you
if
wait
you
for
want to beat the machine, you can press. And then just press the play button again, so you get the 3 numbers.
Sorry.
Oh, yep.
I think she just wants buttons.
Yeah. 63%. Oh,
Yeah.
63% going up. So again, that just demonstrates how you've got to keep an eye on the FiO2 to adjust your flow. I'm just going to crank this all the way up, see if I can mimic that 100% alarm. There we go. Any questions, Lord, whilst we're waiting for this to alarm? Yeah?
I've got a question.
Yes.
Does it provide any PEEP to the patient?
Well, this is controversial
Ah,
now.
okay.
So it can apply a little bit of heat to the patient if the patient keeps their mouth closed. But if you've got a patient who is resting, so my mouth is open underneath the mask, with their mouth open, the air is likely to escape from their mouth, so they're not getting any extra peak. So it's variable depending on the patient's mouth.
And so I'm thinking of the patients that come to ED in Fiji who have a lot of work of breathing, air hunger, your asthmatic patients, your APO patients, and now your severe COVID patients. But I suppose for your APO patients, they often benefit more from some CPAP, non-invasive. And how about use in asthma, Beth?
Yes, they are of benefit of benefit for people with asthma. And I think this probably might be something that can, if they're bad asthmatics, can actually keep them off a ventilator.
Great,
And we
okay.
all know, like from an intensive care point of view, and I'm sure from an ED point of view, asthmatics are really scary to ventilate, really scary.
And you see many severe asthma. So this might help them. I know because you don't have non-invasive here in this, obviously in the eye clinic ED. So I guess this is probably the patient's really, really sick, but not yet arrested or not yet unconscious. Maybe try and use this. Because this will help that whole, you know, when they're so hungry for air while you're waiting for the other treatments to kick in. So this might be your friend.
Yeah, absolutely.
But I think the point is it takes quite a lot of setup, and so the more the staff get really used to setting it up, maybe you can train all the others now with the video, because it takes a few bits, doesn't it? I at home rely on my nursing staff to do this, but if I had to do this in a hurry, I think I'd be a bit stressed. So practice, 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 I think.
Yeah. So that's the alarm that I was on about earlier on. So O2 too high, and that's because we dropped that flow, and we've forgotten to drop the flow meter. So all you need to do to get rid of that alarm is just reduce your flow meter to the desired FiO2. All right. I've got a question as well. I'm just going to do minimal so I don't waste your oxygen. Do you use these on children at all?
They would do in PICU, but I don't know about ED.
I mean, like currently the PEDS patients are managed by pediatricians,
Yeah.
so we haven't had any.
So you don't get any
Patients
children
come,
coming
like,
through?
during this second wave pandemic.
What I might do, just in case
I think it's
that
worth,
changes,
yeah. For normal times, it's nice to know. Yeah. Normal times will be back again soon.
If you do get a child coming through that requires the airvo, the setup is exactly the same, the tubing is exactly the same, but you'll probably just need pediatric prongs, which I presume you may have a stop here.
Maybe in
or you get them
PICU.
from
Yeah.
these.
Yeah.
One of the things you must remember is that this is, at the moment, this is set up for adults. There is a pediatric mode that you can get into by pressing your on-off button. I think it's for 5 seconds. Do you want to have a go and see what happens? With the paediatric mode, the difference is that it won't let you go above I think it's 25 litres. Won't let you go above a 25 litre flow. Alright, so that's just a safety mechanism. Still having a fit.
And just trying to remember, is it 15 mils per kilo usually you start with kids?
No.
No.
Let me think. Is it 15? It's a good question.
I'll look it up.
Yeah, it's somewhere there in the back of my head.
Yeah, I'll look it up.
The circuits are good per patient for 2 weeks. Alright, so they'll last, as will the humidifier. Do you send your airvos to Biomed for them to change the filters at all? How does that work?
We were just about to ask how do we clean.
Yeah, to clean
We
out,
have-
I'll run through.
Because this is brand new. You wouldn't have had this before the pandemic. Yeah.
Something
Yeah.
to us.
Brand new.
We have to take it down to the biomed
Yeah.
and for them to clean or
Not to clean, to service, yes.